Before taking care of the patient, you must wash your hands thoroughly. First, remove any watches and accessories and put them aside. Then roll up your sleeves. Roll up your sleeves above your elbows so your clothes stay dry. Apply soap to your hands. Wet your hands with water from the faucet. Now we'll start washing the inside of your hands. Next, scrub the back of your hands. Start with your left hand, then move on to your right hand. Interlock your hands and scrub between your fingers. Rub the back of your fingers against one palm. Then switch hands. Cover your thumb with one hand and rotate. Then switch thumbs. Now move on to washing your fingertips. Rub your fingertips against each palm. The last step of hand washing is cleaning your wrists. Make sure to scrub in a rotating motion around both wrists. Now you can begin to rinse your hands. Once you've finished rinsing, grab 2 paper towels to dry your hands. So to summarize, start with washing your palms, the back of your hands, in between your fingers, the back of your fingers, your thumbs, your fingertips, and lastly, your wrists. Over the basics on how to take a patient's ear temperature. Here are the basics. The normal range for ear temperature is between 36.5 and 37.5 degrees Celsius. Taking an ear temperature requires you to have an ear thermometer. Pull the patient's ear up and back so the ear canal is flat. Then turn on the thermometer and place it into the patient's ear canal. Before inserting the thermometer, make sure to inform the patient. Then click to take the temperature. Once you hear a beep, you may remove the thermometer. Your ear temperature is 36.6, which falls within a healthy range. Now we have completed taking a patient's ear temperature. Next, we will go over how to monitor a patient's breathing. 1 inhale and 1 exhale counts as 1 breath. A healthy breathing rate falls between 12 to 20 breaths per minute. This is normal. Allow me to demonstrate. My observation shows that you took 16 breaths in the past minute, which counts as a healthy rate. Now we've completed monitoring a patient's breathing rate. Let me now demonstrate how to take a patient's blood pressure. Place the arm with the palm facing up. Now make sure you have the blood pressure monitor prepared. The healthy range for systolic blood pressure is 90 to 140. The healthy range for diastolic blood pressure is 60 to 90. The numbers can't be too low or too high when measuring blood pressure. We are focusing on the bicep area's brachial artery. So place 2 fingers above where the patient's elbow is. Keep it in mind to avoid measuring patients who have just finished exercising or physical therapy sessions, because it is natural to have high blood pressure after these activities. Now begin wrapping the tourniquet. Make sure to place 2 fingers horizontally inside the tourniquet when wrapping so it is not too tight or too loose. Begin taking the blood pressure by turning on the monitor. Press start. Is the wrap too tight? If your patient complains about the tourniquet being too tight, press stop. The pressure will be released upon pressing. The systolic BP is 146, and the diastolic BP is 92. Once finished, make sure the numbers are recorded. We are now finished with the demonstration of taking blood pressure. Let's go over how to take a patient's pulse to measure a heart rate. Prepare a watch or have a clock nearby. We are going to use 1 minute as a unit of measurement. Find the patient's thumb and follow straight down to find the pulse on her wrist. The heart rate is 70 beats per minute, which falls within the healthy range. Make sure the number is recorded. Now we're finished with this demonstration. Let's go over how to take the patient's blood glucose level. When taking a patient's blood glucose level, you need only 1 fingertip. The little finger would work. Now, turn on the blood glucose monitor. Then place a test strip inside the monitor. Place the blood sample on the test strip. The result this time is 105. This falls within the healthy range of blood glucose levels. Now we are finished with the demonstration. Now I'm going to demonstrate flipping the patient over. It's important to flip the patient once every 2 hours. When flipping, be careful with the patient, as we see both his arms and legs are currently straight. We have to cross his arms in front of his chest. Place one arm above the other. First, put the right arm across his chest. Then also move his left arm over his chest. The patient's right leg, the one further from us. Bend that leg up. When flipping, place your hands, one on the patient's shoulder and the other on his waist. Now flip. We are finished with this demonstration. Now we're going to go over the technique of tapping on a patient's back. When tapping on a patient's back, your hand has to curl into a cup shape. When tapping, avoid the patient's spine and shoulder blades. Tap like this. Try it out. Tap harder. Move up and down the patient's back. That's good. Now we're finished with this demonstration. Now I'm going to show you the process of cleaning contused wounds. First, we need to wash our hands thoroughly. Make sure you have these items prepared: Q-tips, saline water, gauze, medical tape, and wound dressings. Let's take out some Q-tips. Open the saline water. Wet the Q-tips with some saline water. And start removing the used gauze. Begin the cleaning process from the inside of the wound and work your way out. By rubbing the Q-tips in a circular motion, removing the fluid and discharge. Be sure to clean all the way to 2 centimeters outside of the wound. When you're done cleaning with the Q-tip, use a brand new Q-tip to clean the wound again, drying out the excess fluid and discharge. Get a third Q-tip. Apply the prescribed ointment onto the new Q-tip and rub it onto the wound. Attach some medical tape onto the gauze. Ensure that the size of the gauze is 2 centimeters larger than the wound itself to cover the wound completely. Keep in mind, this process of caring for wounds still needs approval from professional medical staff members. We are now finished with the contused wound care demonstration. We are going to begin the wound caring process. Before we begin the process, you must wash your hands thoroughly. Make sure you have these items prepared: Q-tips, gauze, prescribed ointment, saline water, and medical tape. Let's begin with removing the used gauze. Wet the Q-tips with some saline water. Clean the wound. When cleaning the wound, be sure to examine it, including the amount, the color, the type of discharge, and whether it smells or not. Clean the wound beginning with the center and move outward. Be sure to clean all the way to 2 centimeters outside of the wound. When finished cleaning, take dry Q-tips to dry out the wound. Check if there's any inflammation or painful points around the wound. Lastly, apply some ointment with a brand new Q-tip. Attach new gauze onto the wound. Attach medical tape onto the gauze. Ensure that the size of the gauze is 2 centimeters larger than the wound itself. Now we're finished with this demonstration. Now we're going to go over the skincare process. The key of skincare is a balanced diet and moisturizing. After a patient finishes showering, you can apply lotion or baby oil over the patient's entire body. Let's begin with applying lotion onto the patient. Squirt some lotion onto your palm first. Distribute it equally onto the patient's skin. Feel free to start with areas that are further from the heart, then work towards it. This helps with blood circulation. Another key point of skin care is consistently flipping the patient over. This helps reduce contused wounds. We could also help maintain the patient's hygiene. Consistently trim the patient's nails and perform the skincare routine. We are now finished with the skincare demonstration. Let's go over the steps to perform an ab massage on a patient that is constipated. Be sure to notify the patient before starting. Excuse me, sir, because you have been experiencing some constipation, I'm going to apply an ab massage to help you with digestion. Once the patient is ready, go ahead and expose the patient's abdomen. Our large intestines tend to go in the clockwise direction, so we massage it in this way. While observing the patient's reaction, you can slowly apply more pressure and ask how the patient is feeling. Do not apply too much pressure. If you do, patients with thinner skin tend to have an inflammatory reaction. Some have broken skin, some have other conditions, so find the right amount of pressure. Feel it out with your palms whether there is any stool within the patient's intestine. Now we are finished with the ab massage demonstration. Let's go over some ways to prevent a patient from falling. The most common time for a patient to fall tends to be early morning or evening. Usually happening from the bed, wheelchair, or chair. The ways to prevent a patient from falling include setting up bars along the bed and lowering the patient's bed to prevent falling from these dangerous spots. Bathrooms are also a priority because bathrooms tend to be slippery and humid. Setting up friction mats or handrails is helpful. In terms of personal accessories, we can provide the patients with some friction slippers, a well-lit environment, and well-fitting clothes, which can also prevent patients falling from stepping on their own clothes. These are some steps to prevent patients from falling. Let's go over some steps to relocate a patient. First, we move the patient's leg closer to us. Try it out. Move the upper body towards you. Gently move the patient off the bed. Sit her up with one hand on her back and one hand behind her head. Now squat down with one leg between her legs. and pull her up from the waist, and move her over to the wheelchair. Move to the back of the wheelchair and pull her up from her waist so she's sitting comfortably on the wheelchair. Then we pull down a leg rest so she can rest her legs. To prevent the patient from slipping off. We can also fasten her safety belt. Now we are finished and have completed the relocation demonstration. Now I'm going to go over how to maintain a patient's oral health. When providing oral care to the patient, try to perform it 30 minutes after each meal, so the patient is less likely to vomit. Sit the patient up high and have a warm glass of water. Prepare a toothbrush or oral cleaning stick. Dip it in the water. Be sure to have gloves on when cleaning. Prepare a towel nearby in case the clothes get wet. You can use a flashlight or any lighting devices to examine the situation within the patient's mouth. See if there's any buildup that we can remove later. So let's dip into the water using the cleaning stick. Be sure to clean every single tooth when cleaning. And feel free to reapply more water onto the stick. Start with the outside of the tooth, then move on to the inside. Rotating the stick also helps with cleaning those teeth. Throw the used one out and grab a new one. Move on to the bottom teeth. Outside and inside both need to be cleaned. Use the last stick to brush the patient's tongue. Be sure not to brush the root of the tongue, or it will trigger the gag reflex. We can simply use one cleaning stick and perform an overall quick clean. With the top and bottom teeth for the patient. Some water is spilled onto his face. Be sure to wipe it off for the patient. We are now finished with the oral cleaning demonstration. Let's begin the body cleaning demonstration. First, prepare a towel nearby and some warm water that's around 40 degrees Celsius. Dip the towel inside and wring it dry. Fold it in half and then another half, and place your palm in between the towel. Start with the face. Begin around the eyes. Inside to outside the forehead. Nose. Cheeks. Chin. Ears. And neck. Limb cleaning. Begin with the upper limbs. When cleaning the upper limbs, raise the arms over the patient's head and clean her armpits. Once finished, move on to the chest area. Wipe the chest area in a circular motion. Then move on to the ab area. Once finished with the abs, move on to the lower limbs. And back. Move the patient toward the carer. Use the bottom of your palm when wiping the back. Apply some force when wiping the patient's back. Lastly, we need to wipe the groin and around the buttocks. Now we are finished with the body cleaning demonstration. Let me demonstrate how to replace and clean the nasogastric tube. Begin with washing your hands thoroughly and putting on medical gloves. Remove the tape on the nasal tube. If needed, grab a piece of gauze or tissue. Wet slightly to wipe the patient's nose. Then wipe the nasal tube clean. Remember the length marked on the nasal tube so you can place it back properly. Before you attach the medical tape, you could clean the patient's nasal canal with a Q-tip, removing some nasal discharge. Feel free to wet the other side of the Q-tip and use it to clean the nose too. Take a small piece of tape and stick it onto the tip of the nose. Make sure to avoid the previous taped spot. If the same spot is being repeatedly used, it tends to turn into a wound. Now we have completed the demonstration of changing a nasogastric tube. Now I'm going to demonstrate the steps to clean the groin area, using a female patient as a reference. Let's wash our hands properly and put on medical gloves. Prepare a pack of washable Q-tips. And a cup of warm water that ranges from 40 to 45 degrees Celsius. Make sure the water is warm and not too hot. Now let's take out some Q-tips. Holding the water cup with your last 3 fingers, place the cleaning mat underneath the patient. When cleaning, we start with the middle, beginning from the top towards the anus. Once done, get a new Q-tip. Begin cleaning with the right labia, then move on to the right labia minora. Rinse off the left labia minor. Then move on to the right labia. Then the left. We're done with using warm water. Take a dry Q-tip and start the drying process beginning from the right. Then dry the left labia. The last step of cleaning involves lifting the patient's buttocks gently and removing the cleaning mat. Pack this up and toss it. Now remove your gloves. Toss them and proceed to wash your hands. Once finished, assist the patient to lay down properly. You have finished cleaning the groin area and will now proceed to cleaning the urinary tube. This requires wetting 3 Q-tips with betadine. And the other 3 with saline water. Be sure to inform the patient before beginning the cleaning process. I'm going to start cleaning your urinary tube. Disinfect the area in a circular motion. Clean the area in between the urinary canal and the urinary tube. Let's wait a bit after disinfecting to let the betadine seep in. Now use the saline water to remove the betadine. Once we finish cleaning the tube, we have to remove the medical tape. And put new tape onto a different area. Be sure to hold on to the tube to prevent it from slipping off. Now assist the patient in putting on her clothing and laying back down. The cleaning of the urinary tube is now completed. Now to demonstrate the process of tracheostomy care. First, start with washing your hands and preparing these items: saline water, medical tape, Q-tips, and Y-shaped gauze. When performing tracheostomy maintenance, be sure to have certified medical staff or family members around to suction out mucus. Once finished suctioning out mucus, remove the Y-shaped gauze. Check if there's any discharge or fluids on it. Take 3 Q-tips and wet them with saline water. When cleaning the opening, observe for inflammation or discharge. Also check for skin conditions. Wait for 30 seconds. And then apply a new Y-shaped gauze. Be sure to perform the cleaning process daily. Once damp, it has to be replaced to prevent the skin from being overly moist. You've now completed the process of tracheostomy care.